You've got this nailed, Andrew, and that is the microbiology of pneumonia. How does pneumonia react with the virology of the COVID virus is the major risk to the president?
Well, as you stated, we know the president is in one of the high-risk groups for serious consequences of SARS-CoV-2 infection. We know that it's really going to be now a process of monitoring. We want to see how the symptoms progress. We know that when it comes to a few days down the line, there's a turning point where your own immune system begins to drive some of the symptoms that you're feeling, and it's that sort of fulcrum point that'll be critical to watch for. We all hope that this turns out to be a mild to moderate case, but again, he's got a staff of doctors around him who will be monitoring for all these changes that might hint at more severe disease.
They're the macrolides, and of course, we all have heard of Zithromax with our family that have been sick with pneumonia. Do the effective drugs of pneumonia, are they less efficacious with a virus?
Yes. Viral pneumonia and bacterial pneumonia are treated in very, very different ways. And the progression of disease in COVID-19, again, starts with the virus, but it ends up being driven by aspects of your own host immune response. So the drugs that are effective early in COVID-19 often aren't effective late, and you have to rechange the thought process in terms of how you're treating individuals as the disease progresses. Now, if there's a good part of this story, it's that the U.S. medical community has learned a tremendous amount about how to take care of COVID-19 patients, both in mild as well as severe disease, over the course of the last 6 months. So hospitalization rates have been going down, death rates have been going down. Some of that is due to demographic shifts in infection, but a lot of it is due to doctors now knowing how to treat their patients and get better results from the more severe cases.
Andrew Pekosz, just so I'm sure that I understand correctly, I mean, does the President of the United States, does he have a better chance of of this disease not turning ugly because of the care he's getting, as opposed to, the common person on the street?
Well, he's obviously got a staff that's completely devoted to keeping his health as the #1 priority. So I think that's a great advantage. Obviously, he's going to be having doctors talk to him on a very regular basis over the next few days. And again, everyone hopes that the course of infection here turns out to be more mild and moderate. Another thing to mention, though, is we're talking about the president a lot about his symptoms, but the other thing that has to go on right now is the contact tracing. This appears to be an event that was localized in a number of different settings where lots of different people were coming together under conditions where the virus could be transmitted. So we should also remember that behind the scenes, public health officials are now going to have to go into overdrive to find the individuals who are potentially in situations that could have been exposed and get them into testing protocols as soon as possible, because, again, this is a very important part of our federal government, and we need to make sure that these people are being tested early so that the infection chains can be terminated, as well as now focusing on caring for the people who are infected.
The U.S. is also one of the most divided countries when it comes to mask wearing, whether it's effective, whether it infringes on civil liberties. Will this change the narrative of the United States and the regulations around it?
I certainly hope so. You see me here with my mask around. The data is quite clear that masks and social distancing work to reduce the risk of transmitting SARS-CoV-2. It's not something we all enjoy doing, but it's something that is effective. And as an epidemic wears on, we get a little fatigue for these things. But we have to realize that there are effective ways that we can limit transmission of this virus, and we just have to really double down and really redevote ourselves to utilizing these things in an effective way.
Doctor, I'm sure the low point for you in the debate was the back and forth between the two candidates over the ventilator. People like you are knee-deep in it. I'm sure you know that horrific sound of ventilators under stress in an emergency room in any given hospital. If the president deteriorates and goes on a ventilator, we're afraid of those things from February and March of this year. Do we have a better knowledge of use of ventilator now if someone gets pneumonia, if someone has this virus?
Absolutely. And it's clear that getting on a ventilator is a very a poor prognosis for a person. But we now know that there are a number of different things that we can do instead of putting a person on a ventilator, which have shown a much better prognosis in terms of outcome of disease. So yes, there are lots of things that can be done now before ventilator becomes a necessity, and all of those things have been associated with better outcomes.